is Michaela Myers. I'm a rising M2 at USC School of Medicine, and my summer research project has been investigating ways to improve PrEP awareness in medical trainees, and that is with Dr. Kamal-Sanasi at the Palmetto Health Immunology Center. And I don't have any disclosures to report. And today I want to go over the basic information about pre-exposure prophylaxis for HIV, help you identify the appropriate patient population for PrEP, talk a little bit about implementing PrEP in your practice or future practice, and talk a little bit about some barriers to PrEP implementation in the nation and in our state. So what is pre-exposure prophylaxis? It is a way to prevent an uninfected person from acquiring a disease, like how you would give anti-malaria pills to a traveler before they go on their adventure. So PrEP for HIV has been shown to be safe and effective at preventing new HIV acquisition in at-risk adults and adolescents over 35 kilograms if used daily. And the drug itself is a daily combination of tenofovir and emtricitabine. Those are two different antivirals. Those are nucleotide or nucleoside reverse transcriptase inhibitors, and the brand name for that drug is Truvada. And you might recognize those two drugs from Hep B or HIV treatment. And moving on. Before we dive into PrEP a little bit more, I wanted to give everyone a little bit better of a background for HIV and AIDS in the nation and in South Carolina itself. So you can see these rankings that South Carolina is ranked number 8 in the nation for new HIV cases as of 2016. And you can see in this chart that southern states actually make up number 1 through 8 of the top 10. So you want to keep that in mind for new HIV cases in the state and in the South itself. Southern states actually account for about half of all new HIV diagnoses in the nation, but only account for 38% of the nation's population. So in South Carolina, our metropolitan areas are kind of a bit of hotspots. Columbia is actually down from 2015. In 2016, they are now ranked number 11 in the nation. And Charlotte is number 24, Charleston at number 29, Greenville at number 52. So for AIDS cases in 2016, South Carolina is tied with Delaware for number 10. You can see in this chart again, most of these states are southern states. And for our metropolitan areas or districts, Columbia is ranked number 6 in the nation, and that is actually down from 2015. And 23 is Charlotte. Charleston, North Charleston is number 26, and Greenville, Anderson, Malden is number 51. So going into South Carolina's new HIV and AIDS cases a little bit deeper, of the new cases in 2015-2016, almost 80% were male, 40% were between 20 to 29 years old, 77% were MSMs, that's men who have sex with men, and 63% were Black. So you want to keep these statistics in mind about who is getting a new HIV diagnosis in South Carolina to think about who would be a good candidate for PrEP. So in South Carolina, only about half of our HIV patients have a suppressed viral load in treatment. So the other half are unsuppressed and can transmit HIV to an uninfected person. And that's why it's so important for us to talk about PrEP today, because we want to make sure our up-and-coming providers feel comfortable with prescribing PrEP to their patients so that we can prevent uninfected persons from acquiring HIV in South Carolina. So the CDC guidelines have outlined 3 populations that would benefit from PrEP in the distant future. So those would be our MSMs, heterosexual men and women, and IV drug users. For your MSMs and heterosexual men and women, you want to consider PrEP if they are commercial sex workers, have an HIV positive partner, if they have a recent STI, they have multiple partners, a history of inconsistent or no condom use. And for your heterosexual men and women, you want to take into account where they live geographically. So if they live somewhere like Columbia, somewhere like Washington, D.C., that are up high in those rankings we just went over. And for your IV drug users, you should be asking about if they have a HIV positive injecting partner, or if they are sharing needles or injection equipment. So not included in this large chart is transgender and lesbian patients, and those are included in the PrEP guidelines more specifically in their own little section. So just make sure you don't forget about them too. So we've outlined these 6 questions you need to ask on your sexual and social history for the past 6 months to identify if your patient is a high-risk person for acquiring HIV and if they would benefit from PrEP. So you make sure you're asking about type of partners, number of partners, type of anal sex, either receptive or insertive, HIV status of their partners, and if they're using IV drugs. So moving on, your patient comes in and they've decided they want to start PrEP, but they are asking you about whether or not it works at preventing HIV infection. So you can see in these large sample size trials, the top 3, the iPrEP study, the Partners PrEP study, and the TDF2 study, PrEP was found to be effective at preventing new HIV acquisition between 44 and 84% of the time. And women, you can see in this chart also that women had a little bit lower efficacy numbers, and that was found to be due to adherence issues. And so women just have to work a little bit harder about taking their PrEP every day. So continuing on the theme of adherence, when there's a level of drug measured in the blood, it is found to be 90 to 92% effective at preventing new HIV acquisition. And that's the most important take-home message from this session, is that PrEP is effective at preventing new HIV diagnosis, but only if it's taken every day. So your patient has started on PrEP. What are some side effects that they can expect? So in the first month, they might expect some GI upset and headache, and that should fade away within about a month of starting. And some uncommon side effects would be a decrease in renal function or bone mineral density. Those are subclinical and should either stabilize or return to normal after they stop PrEP. So what kind of labs do you need to be doing before and while your patient's on PrEP? So before they start, there are several labs that you're going to want to order. So you want to make sure they're HIV negative, Hep B negative, Hep C negative, get a baseline creatinine, and make sure that their STI screen is negative or treat any STIs that they have. And if while they're on PrEP, you want to make sure that they're getting an HIV screen and a BMP for creatinine level every 3 months. So if they don't come in for those 2 labs every 3 months, you should not refill their PrEP prescription. So diving in a little bit deeper about STI testing, for MSMs, the CDC recommends testing them for STIs every 3 months. So your MSMs need triple site screening, rectal, oral, and urine every 3 months, and your heterosexual men and women and IV drug users should be tested every 6 months. So while your patients are coming in for these labs, leave a little bit of time for some risk reduction counseling about safe sex and clean needle use. And PrEP has been shown to be more effective in the studies that also emphasize condom use. So make sure you're providing and emphasizing condoms at every visit. And here I've listed some of the most prevalent barriers to PrEP implementation in the state and in our country that are mentioned in the literature. We won't go through each one, but the one that I get asked about the most would be cost. And PrEP is actually covered by Medicaid and most insurance plans because it's less expensive for an insurance company to cover the cost of PrEP than it is to treat someone for HIV for the rest of their life. So if they are underinsured or uninsured, the drug company itself provides a medication assistance program to cover the cost of the drug or provide a copay card to cover the rest of it. So moving on, for side effects, we touched on that a little bit already, but you can provide over-the-counter meds for your patients and make sure you're revisiting whether or not they still need PrEP at all every 12 months to a year. So you want to make sure that their lifestyle might have changed. So you want to make sure that you're still asking if they still need PrEP after a year. So these last 2 bullets I consider to be the most important for us to go over in this session, and that would be risk compensation and heterosexism. So for risk compensation, that's the idea that a patient that is on PrEP would be less likely to use condoms and would get STIs more frequently because they feel that they're protected by PrEP. So this has not been shown to be 100% true in the data. The data is pretty mixed so far, but you want to make sure that you're emphasizing condom use and screen for STIs frequently while your patient is on PrEP. Make sure they're not getting any new STIs. So for this last bullet, heterosexism is the idea that it was actually discovered in a study on medical students. So medical students that express greater heterosexual beliefs were found to predict poor adherence and risk compensation in their MSM patients, and that affected their medical decision making about whether or not to give that MSM patient PrEP. So make sure if you're prescribing someone PrEP that how you identify yourself does not influence your medical decision making, and make sure you and your colleagues remember your cultural competency training. And that about wraps it up for barriers. But if you're still interested in finding out more about PrEP, or you want to dive into those efficacy studies a little bit more, I provided the links to the USC telehealth, and that's every second Wednesday at noon for primary care providers. And I've also provided the link to the DHAG page and the link to the CDC guidelines for PrEP. I've also listed the PrEP line for clinical questions about PrEP that you might have. And I've also listed the link for the Advancing Access Drug Medication Assistance Program at the bottom of the page. So I really appreciate you taking the time to watch this seminar during your summer, and don't forget to take the post-education survey. It should come automatically to your email on August 6th. And thank you for watching, and have a great day.